Good afternoon, everyone, and thanks for joining us. I'm Sue Peters, and I'm the Vice President of Community Impact at the Community Foundation of Greater Flint. My job today is really just to welcome you again and thank you for attending, talk a little bit about the origins and creation of the Pride Fund and our goals for growth and what we have planned moving forward. But really, the main thing is to just get out of the way and hand it over to the guests that we have today. We have some amazing community partners working in this space, and we want to make sure we save the time for you to hear from them. But just to talk a little bit about the creation of the Pride Fund, it started when Sandra Murphy, who worked at the Community Foundation of Greater Flint, decided that before she retired, she was bound and determined to start a Pride Fund. And she knew it was kind of there were two sides to the coin. One, we didn't really have any donors who were interested in creating an endowment fund. And then on the flip side, we also weren't getting many proposals. So she basically voluntold, I think would be the word to say. Dale Wayhill and I joined her in that. And what we did is we had a lot of conversations with the community just to figure out what was going on. We had a number of conversations with funders. But we had a really broad plan of doing a scan, figuring out needs, but at the end of the day, decided to just get started. And so we started with a goal of $50,000 for this endowment fund so that one, we could attract donors and we could support some of the services that we knew were a gap after the conversations that we had. And so it was, small gifts, the founders, we just started it, small gifts and, small gifts count, big gifts count. Dale had a birthday party. So if you have never been to one of Dale's parties, you're going to get a chance again this summer because we have some more plans. And then Sandra, for example, had her donations for her retirement party joined to the fund. Me, on the other hand, I'm just trying to keep up with both of them and give as much as I can in many ways as I can. So the good news is in 3 years, we reached our goal of $50,000. We not only reached it, but surpassed it because of investments. So what we want to do is set a new goal, right? And so what our new goal is to double that. We just want to double the pride is what we're going to say. And I think I have enough pride for everyone maybe, but maybe I don't actually. So let's just double the pride. We are going to go ahead and have a Pride Fund Giving Day next Monday. That'll be going live on our website. Some more information will be going out on our social media today. So that's our plan. We want to continue to grow the fund. What we have is a great start, but it's not enough to continue to fund the great programs that we have in the community. You'll hear from a couple of great partners, as I mentioned, about the services that they are providing, but there could also potentially be gaps that we don't know of that we need to fill as well. And with what we have, we can do small grants, but we can't do enough. So we would really like to continue to grow that fund so that we can do more. So again, look for Double the Pride. The Pride Fund Giving Day will be next week, Monday. So don't miss that. Because I do have the mic, I want to give a couple of shout outs if I can. I wanted to just give a couple of quick shout outs to our background crew at CFGF who really helped us put this together. That's Alex Dawson, who helps us with all of the cameras and this platform. Mary Jo, our AVP of communications, helps us so much and just marketing the fund and helping us to stay on message. And then Becky Pettengill is really our staff who's facilitating the fund and helping us stay on track from the donor side and meeting and all of that. So really important folks. We couldn't do it without them, so thank you. And then one last shout out, you can see in the back, there is a spray paint on canvas. This was done by one of our Flint Public Art project artists, Brett Huzega. And Brett, I apologize, I know that's not how you pronounce your name, but just a thank you to all of the artists and folks who are continuing to support the community. So the other thing is, I'm sure I got the history wrong of the fund, but just know that we have our Passion and Purpose magazine will be out on our website next week, and it focuses on the fund. So you can double check all of the numbers and dates, and there's more of the story about the fund in that, and some of our grant making, because we have been able to do some great grant making even before the fund has grown. We're already working on supporting folks in the community, our partners. So take a look at that as well for more information. It's a great addition. So finally, what you are really here for today is to talk. You remember that this is our second podcast like this for the Pride Fund. And the last time we really talked about staying vigilant around policies and the need for more advocacy. And today, though, what we want to focus on is really linkages. So linking our services to the LGBTQ population, linking providers who have the experience, have the knowledge of professionals and their own lived experiences in order to provide really effective services and impactful services to the population. So that's what we have today. Some of our favorite partners, some of our on-the-ground partners who we get to work with every day. But I'm going to hand it off to our staff person, Lydia Stars, and she's going to facilitate the conversation from here.
Thank you, Sue. Thank you. Good afternoon, everyone. I'm Lydia Stars. I'm a program officer at the Community Foundation, and I have the privilege of talking with our two guests this afternoon. Stevie Atkins is the CEO of Wellness Services, and Nisi Holloman is the CEO of Voices for Children Advocacy Center. Both of these ladies have been wonderful partners in this work. We go back quite a bit. But I'll get to that a little bit more. First, I want to turn it over to them to introduce themselves and share a bit about their organizations. Stevie, I know you can't be with us on video, but she told us she has a really cool Pride t-shirt she's wearing, so everyone can sort of visualize Stevie in her awesome Pride shirt. So who wants to start first? Stevie, do you want to go ahead and introduce yourself and Wellness?
Sure. Thanks so much, Lydia. And thank you to Community Foundation for having these conversations. They're really important. So I appreciate that. Wellness Services started really in 1985 is kind of when Genesee County started to really see an uptick in HIV infections. Jill C. Ramsayer is our founder. She was a health department nurse at the Genesee County Health Department. And she saw these deaths happening. She saw disparity around the deaths and also disparity around support for families that were experiencing loss of a loved one. And so she sort of combined all of her resources that she had at her disposal and tapped other medical professionals and other friends to create kind of a buddy system or a hotline that you could call to say, you know, here are some needs that I have, or maybe you were bringing a loved one home to pass away. And so she would help coordinate hospital beds, people to sit with individuals that were really sick, but also to kind of, in addition to providing sort of that social support, they were also able to provide some of the medical support as well. And so the organization in 1986 formally incorporated and became Wellness Networks. We were an extension of Wellness Networks Detroit, which was the first AIDS service organization in the state of Michigan. And so they were really instrumental in kind of allowing us to follow the footprint that they had already laid in terms of how they were assisting individuals with HIV and sort of, you know, what resources they were pulling in to assist individuals. So we became Wellness Networks Flint. And for many years, we kind of shadowed Wellness Networks Detroit before we finally became our own entity, Wellness HIV/AIDS. So that was sort of the beginning of the history. And I think that as the epidemic sort of raged on, there was more of a need for longer case management type services. I remember when I began as an intern 20 years ago at Wellness, one of the things that was really striking to me is I was charged with purging files, older files, and I would notice that the file just had a single document, maybe an intake, and then an obituary followed really shortly after. So I think that looking at how quickly people were passing away after they were diagnosed with HIV back then, and now we can kind of fast forward to individuals with HIV who have access to medical treatment and are engaged in their medical treatment are able to live long, healthy lives. And so that's what we're continuing to do, is sort of follow that legacy of, understanding the needs of the population that we serve, and to continue to provide access to resources that are really, really critical to the community. So now we have our HIV case management program. We have HIV prevention and education, where we're able to provide community education to those that might be at high risk for HIV. We also have a harm reduction program that includes syringe service program. And we were the fourth in the state to have, Flint was the fourth in the state to have something like that in their city or in their community. We also do a lot of community events. We are the host of Flint Pride. We do lots of awareness events around National HIV Testing Day, which is June 27th, Black AIDS Awareness, which happens in February. So there are just a lot of opportunities for us to engage community around issues that affect people living with HIV, as well as the LGBTQ plus community.
So I guess it's my turn. I am so grateful to be here with the Community Foundation and Stevie, who does phenomenal work over at Wellness. Voices provide services to children in Flint and Genesee County, as well as Shiawassee County, that have been victims of child abuse, neglect, and human trafficking. And we work in tandem with law enforcement, child protective services, the prosecutor's office, as well as the hospitals and mental health providers. And what we do is we're really here to be that barrier breaker so that kids are not going through the system by themselves. So we're providing case management. We are also a place where kids come and initially tell their first story, or tell their story about what happened. It's the first time that they've gone through their own trauma narrative, as law enforcement and child protective services listens to what has occurred and happened to that kid. But they're not left alone after all of that happens. We have therapists that walk with them. We have crisis counselors that are there. We're preparing them when they have to go to court. We are doing support groups, family therapy, individual therapy, group therapy, providing medical exams for the children in a one-stop place. So they come to what they call the Big Blue House. And so the reason that we got involved with working with children who were, as they tell me all the time, we have reclaimed the word queer. So I usually go LGBTQ plus, and they always say, Miss Nisi, please, we're queer youth. And so in solidarity with what they have asked me, I will use those words, recognizing that for some people, queer is not reclaimed for them, but for the kids that we serve, I want to, and I know that they're watching, I want to be respectful of what they've asked. And truly, it's because we started getting kids who were victims of child abuse because they came out to their family as being queer. And queer is inclusive of all of LGBTQ. And for some people, when they are first trying to really understand what that means, it's not that the kid is just gay. We were getting kids that were pansexual, demisexual, that were bi, and their parents didn't understand it. They weren't accepting. Kids were ending up on the streets, victims of human trafficking. They were homeless. They were getting raped by family members to make them straight. And I use that in air quotes because that's what their trauma narrative was. That's what was said to them. And so when we recognized what a great issue it was, we approached Wellness, who is in our community seen as the expert because they're dealing with this all the time. And we started talking about the things that we could do to provide education, not only to our staff, but to other service providers and stakeholders. And so we have a number of children who come to us for therapy services that are a part of our support groups because we work with not only the child, but their family to help bridge a gap so that we can educate the parents on what it actually means. Like, there's nothing wrong with a child that identifies as queer. There is something wrong if you want to abuse your child or you put your child out of the house because they identify as queer. And so that's how we got into this. But we really are like the baby sister of this because we're always going to Wellness and asking Wellness to help us out with things. We do joint trainings together. And I know we're going to get into some of those things later, but I have to say that Wellness was truly a huge supporter of the work that we were trying to do when we recognized that there was a gap in a trend of homeless youth and stakeholders and providers that were not educated to provide services to youth who were queer.
Thank you both for sharing a bit about your organizations and sort of the context for how you're engaged in this work in community, and particularly working with LGBTQ persons. So I want to talk a bit about the history, because right around the time the fund was created, we all started meeting as a work group. So it was Wellness and Voices, other nonprofits, some community members. We got together and we really started mapping out in our community what were our assets, what resources did we have that existed, what services did, existed for LGBTQ persons specifically in community, what were the gaps, and then we began conversations of, okay, what are the actions that we're going to take to address gaps or to improve services that do exist. And so we had a pretty significant list of things that we wanted to do, right? But one of them that floated to the top, something that we prioritized, was training, as Nisi mentioned. And both Wellness and Voices took a lead role and partnered up to develop a menu of training opportunities, really, for community service providers, so that way they could be engaged in learning more and building their skill sets and knowledge. So it's been quite some time. I think that was like late 2018, right? So it's been a few years. I want to hear from you both sort of how's been the implementation of those trainings. I know COVID has certainly had impacts on how training and other services are delivered. So any feedback on, how that's made some changes? And then what do you think still are future opportunities around trainings?
Well, if you want me to start, Stevie, I can. I'll say one, it's this collaboration that Wellness and Voices have in training, right? And so recognizing when where training is necessary, we're always referring over to Wellness, any entity that needs to have training. But some of the key things that came out of that, like we had this, we spent a number of days coming up with what can be done for the LGBT community, where we saw gaps, what needed to be done, doing research, how many gay straight alliances did we have in the high school, recognizing that we did not have enough, looking at what safe places we had. But really, we put a linchpin in making sure that the community providers that we knew people were going to were trained. So an example would have been GHS. GHS, we knew a lot of people were going to GHS, and so they were at the table and they were willing to ensure that every single person in their organization was trained in one, understanding trauma-informed care for LGBTQ, understanding the terminology, understanding how to work and how to work with people in that community, and not to be educating where the person is educating the provider about what it means to be trans or what it means to be pansexual. And so not only did we have a training with all of their staff, but they now have it implemented in their orientation. And so that is like a tangible thing that came out of that work group. But then we also had a conversation with many of the foundations, and we were grateful to be with the Community Foundation, because we were able to talk about, well, we don't have enough data. We don't have enough data to see who is serving queer youth or queer adults. And so we had different foundations that were willing to help us track that by ensuring that those that were receiving funds from those particular foundations, now when we're reporting back on information about services for queer youth, so that we can talk about who's serving the queer youth, and or the LGBTQ community, so that we're able to move forward and get the data that's necessary to obtain additional dollars and to also provide the services that are necessary. Stevie, I'll hand it over to you.
Thanks, Nisi. You did a great job. I think one of the things that really stood out to wellness is that this need for continuing education with providers, because so many of our clients come to us to share experiences within the medical community about the discrimination that they've experienced, especially for Black, Brown, Indigenous people of color that are queer identified. And so, our thought was, rather than pushing organizations away and saying, like, stay away from that place, it's not safe for you. We wanted to extend, our services and our training to those organizations to sort of provide that base level education around the population and the needs that they have, and the disparities that they experience because of the medical system, because of racism, transphobia especially. Transphobia is a huge, huge barrier to the trans community. They're very disenfranchised. And so a lot of organizations, even if it's not the organization that is being sort of traumatic towards the individual, it may be the other clients and maybe the other individuals in the shelters. And so it was really important to us for those organizations to at least have access to those critical trainings so they could better serve the same folks that we were serving without the discrimination. And so one of the really big challenges over the years for wellness has been that while there are dollars out there for HIV services, there are not dollars out there for LGBTQ plus focused services. So it really was not until the creation of this Pride Fund that any organization serving LGBT folks in Flint or Genesee County even had the ability to sort of like apply or leverage funds through another foundation or through another entity. So these were really critical funds. We knew and understood that they were critical funds. And as Nisi said, wellness and voices really got together to say, like, how can we maximize the dollars that we have to ensure that these trainings happen? And I'll tell you that for a lot of years, wellness has been doing implicit bias trainings, trainings around social determinants of health, and other sort of, really important kind of critical foundational trainings without any funding. We do it because it's important to educate our community and to create additional safe spaces in our community for our LGBTQ plus population. And so that's kind of how we got going down this road. We've continued to provide the trainings despite, as Lydia mentioned, COVID. So we've been providing virtual trainings and, sort of looking at our transitional plan to begin offering the in-person trainings again, probably by fallish. So yeah, so that's where that's at. Really, honestly, Community Foundation has been so essential in, sort of providing us the financial support to ensure that these trainings can happen and that providers do have access to them. So we're greatly appreciative for that, and as well as the partnership with Voices. That's been a huge one for us.
And Lydia, just to that point, I just want to say, like, the catalyst of being able to be with a foundation and know that there is a Pride Fund is critical to our community to say that this is important and kids need to know. And I come from a very kids perspective because I sit and I listen to the kids and I hear what they have to say. And when you look in a community that is the 5th largest county in the state of Michigan, but we only have 2 gay-straight alliances in our particular county, that it talks about the resources that are there for LGBTQ youth, right? But then when they find out that we're doing trainings and we're working collaboratively together and we're having these community conversations, and that there's a Pride Fund and that the community is wrapping their arms around it, that I just was at the Boys and Girls Club the other day, and their social media, if you look at their social media page on Instagram, they are showing their pride there. People have changed their pictures on social media, and it's just a great movement to show that we are 100% accepting of the youth that we're serving. And so when I look at my numbers from 2018 of the kids who were coming to the center saying that they were LGBTQ youth and they had suicidality or that they were cutting on themselves, compared to now where there's more education and we're working with the schools and we're providing those virtual trainings to the schools in collaboration with wellness and making sure that you have educators that are educated, and that we're working with the parents to make sure that they understand what it means to be a queer youth in 2021. The numbers are trending down, and it's really because you have the Pride Fund and you have the ability to do the training, and we were able to sit down at a table and come up with what that looks like. And then also working with people who are of the trans community as well, because we don't only want to just talk about LGBT. We want to make sure that, well, T is the trans, but we want to make sure that we're inclusive of the entire community, and that we have representation and training from the trans community as well.
Thanks. I know we're grateful to have you all as partners. You know, we get to be the vehicle for the generosity in the community and connect it with providers who are providing essential services and really meeting the needs, and who are the experts. So we feel really lucky to be able to do that. And, you know, prioritizing vulnerable populations is one way that we really live into our equity commitment as a community foundation. So thank you both for all the work that you're doing. I want to transition a bit, although this has come up sort of in our conversation about training, the topic of homelessness and the needs around emergency shelter and housing. So I don't know if this is the most recent statistic, but about 40% of homeless youth identify as LGBTQ+. That's a shocking number to me. And I imagine the adult population has similar numbers as well. And so while we know that training is one way that we can work with local providers who are working to reduce homelessness and providing emergency shelter and housing, that's not the only thing that we should be doing. So I'd like to hear from you all, beyond training for staff around housing and emergency shelter, what are some of the other things that we can do to be addressing homelessness and housing for LGBTQ persons?
That's a really great question, Lydia. And you're correct about the statistic. It's really tragic that 40%, that's what we're working with here, and that there isn't, in the state of Michigan, Ruth Ellis Center in Detroit is the only LGBTQ+ specific shelter. And this has been a critical need in Genesee County for a very long time. We utilize our partners at Reach for those that are, under 21. But again, it's not a shelter that's LGBTQ specific. And so oftentimes with that comes a lot of, discrimination from other residents or other shelter, clients. And so this is a continued need, because our clients that we see at our agency do not feel comfortable being put into the general population of any of the shelters in our community. They also do not feel comfortable going to the warming centers. They often don't feel comfortable going to food giveaways because, especially for trans folks, the visibility for them is, it leaves them open or susceptible to discrimination and experience additional trauma. And so one of the ways that wellness has attempted to respond to that need is by opening our Safe Space Ally Center, which is just a larger room in our organization that we have, computers set up. We offer LGBTQ+ type workshops. We do game night and streaming movies and all that kind of stuff that, at least allows people a safe space to be during the day, especially when it's really hot out or when it's really cold out. That's when we see our safe space numbers go up. It is a very small space, so it doesn't allow us to have, a full center. And that's one of the next goals for wellness, is to figure out, what type of building that we need that would help support the needs of our community and to give them LGBT specific spaces to occupy and just sort of receive programming and education or whatever support system that they need. With HIV case management, we can offer food and transportation assistance and housing assistance, but there isn't any LGBT funding that allows us to do the same thing for that population. So that's definitely something that we see as a gap and are continuing to work to try to meet that gap. We're not housing specialists. We're mostly public health. So identifying a good housing partner that is inclusive is going to be really important in making this a successful place that people actually want to, go to. So that's kind of the next big thing on the horizon for us. I don't know, Nisi, if you have anything to add to that.
I was just going to talk about, and I know we're not talking about training, but it's really around education of parents as kids are in middle school and they're figuring out what their sexuality or their gender is. And it's really about making sure that we have parents that are inclusive and open-minded. And so that's some of the work in the space that we've been in and working with families to support their queer youth. And Stevie is 100% correct. 40% of youth are homeless. And I mean, when you look at the human trafficking numbers, you see a high number of queer youth that are victims of human trafficking because they're just looking for a safe place to lay their head at night. And for a county the size of Genesee County to have only one safe space, which is at Wellness, is not a good thing, right? We need safe places as far as the county lines, and we need more than just one. And we need the beds for not only the youth, but for the adults that are discriminated against in at hotels, at apartments, in many different places. And people don't necessarily understand it. Me as an ally didn't fully understand, as a heteronormative, like cisgender person, did not understand what the discrimination was until we really started partnering with Wellness and looking at the fact that we have youth that literally will stay in abandoned places, abandoned buildings because they don't feel comfortable going to a shelter. And I will say that the executive director at REACH is really trying to figure out what to do in this perspective. We just got done doing a collaborative training with REACH and all of their staff, with Voices for Children and the YWCA and Wellness, where we all had all of our staff together, one, to just do trauma-informed care in serving members of the LGBTQ community. And so that's one step that we've done, but it's way bigger. And Stevie hit the nail on the head. Like, there has to be housing partners that are willing to provide safe spaces that are not necessary, that are dedicated, let me just put it this way, that are dedicated to the queer community, because it's necessary and it's needed. If we can have safe spaces for other different types of communities, it's necessary that we have a safe space and a housing space. And we have a safe space, but I mean a safe housing space for the queer community.
Thanks. So before we jump into any Q&A from the audience, I have a couple of final questions, unique questions for each of you. So Nisi, I'll start with you because this sort of, I think, builds on some of the things that you touched on just a moment ago. In terms of youth, what opportunities do you see for creating more affirming spaces in schools or in other youth serving organizations?
It goes back to not only education, but intentionality. It's about ensuring, it's not about just saying, hey, I have a sticker, I did a training. It's about doing the work and listening to the youth. We cannot continue to operate in this place of, oh, I am trained, but we're not listening to what it is that the youth want or need. For instance, right now, Voices has pinwheels out. Like, we're known for our pinwheels for Child Abuse Awareness Month. Well, we have Pride pinwheels because we had a kid talk about the fact that it would be really cool to see Pride pinwheels. I said, listen, you have said nothing but a word. I will find some pinwheels, even if I have to make pride pinwheels. And so we put them out just as a means of solidarity, but it's about listening to what it is that the youth wants. So creating a restroom that outs a kid is not a safe place for a student that's in high school, right? So it's listening to what it is that the kids need. There's all of these things that adults continue to do, and we're like, oh, this is a great idea. But until you actually talk to one, the members of the community, the queer community, and two, the youth that are impacted by the decisions that are being made, you cannot make those decisions and just say, oh, well, now we're a safe place. There's a medical facility that the youth were going to get condoms and different things like that. And so I contacted them because the queer youth said that it wasn't a safe place for them. And I said, what are you doing to be a more affirming place? And they said, oh, we have a rainbow. And it's a rainbow in a mural. And the mural is like just focused on everything else. And it's just this little baby rainbow. And I said, that's not being intentional about anything. And so I think it's really just having a conversation and being willing to make the change.
Authentic allyship, right?
Exactly. And being comfortable with challenging people that are not willing to be authentic in their allyship.
And nothing for us without us.
Absolutely. Yeah.
Exactly. I mean, you can end this right now with just that.
Like, we don't need performative allyship. That's not what's helpful. Putting, rainbow stuff up, that doesn't, it doesn't mean that space is safe. So as Nisi said, voices they're just so important, to have the voice of people with lived experience before you make programming. I think a lot of times we assume what people need without asking what they need. And so that's exactly what I mean about nothing for us without us.
Yeah, absolutely. That is a great way to sort of sum up this conversation. But I did want Stevie to have an opportunity to share anything about Pride Month, because you have been historically the leaders around the planning. And so I want to know what's happened already, what's coming up, either locally or even statewide, that viewers can engage in.
Sure. So Pride has looked a little bit different for us in the past few years, just to be responsive to COVID, and really the LGBTQ plus community is really vulnerable. So, we kind of are looking at how are ways that we can still celebrate, acknowledging that people have been cooped up for a year, that there's sort of progress that's being made again, instead of what was happening under the previous administration. There are reasons to celebrate, and we want to acknowledge that. But at the root of it, we're a public health agency. And so bringing 3,000 LGBTQ plus and allies together to celebrate doesn't feel responsible. So what we've done is we're working with our Pride Committee to create several events throughout the summer. We're calling it Pride 365, and it actually extends into the fall, sort of between June and October. Some of the initial events that we have in June, June 24th is on that Friday, that is our annual Pride Cookout at our office. We'll have a few other direct partners that will be out there to sort of, provide education. We do a cookout, it's kind of our thing that we've done every year, and it doesn't have a huge turnout. So we feel like it's, we'll be able to properly social distance, and, masks are obviously strongly encouraged. And then we will also have an open mic night. And so there will be more details about all these events that I'm talking about on our Flint Pride page on Facebook, if you want to check it out. U of M Flint is doing a Pride Ride, which is really cool. And then we're even having a roller skating event coming up in the summer. So as those plans are finalized, we'll be posting them on the Flint Pride page. We definitely want to acknowledge and celebrate with our community and create safe ways to come together. But we just want the public to know that we're not having the large event just because, health disparities exist in the LGBT community, and we would hate to create a super spreader event that caused harm to the community that we serve. So we're trying to be very mindful in how we're moving forward.
Yeah, absolutely. I don't think I'll be at the roller skating event. It's been decades since I've even attempted that, but good luck to all those who try it. So let me check on the comments really quick to see if we have any questions.
While you're doing that, I just want to throw out there, and it was a couple of my staff that brought this up. As you're looking at buying Pride gear and T-shirts, be sure to try and buy from somebody in the queer community, not from these big box stores like Target and other places, because we want to make sure that we are supportive. And so we have a list of places. I'm sure Wellness has a list of places. And if you're like, I already bought a shirt from one of those places, then donate to the Pride Fund on Monday. Those are really good ways to either support Pride or be an ally with all of us in the work that's being done.
That's amazing. And yeah, if you can share those with us, I know Mary Jo and Alex, they'll definitely push out the upcoming events, for Pride 365 and, anything related to local businesses. Please do share so we can share that information with community on our social. So I'm not seeing any questions that came in. So I think we could probably bring Sue back and have her kind of close us out. I just want to say thank you to both of you for taking time today to have the conversation. It was great to see you.
Thanks so much for having us.
And thank you for doing this, and thank you for the Pride Fund. I mean, I think something said it well, but knowing that we have a Pride Fund only supports the work that Wellness is doing every day, and Voices is doing with the work that we're doing with the kids. And we just feel very, very fortunate that you guys are willing to listen and hear us out and host us. Not only did you guys have the Pride Fund, but they allowed us to meet at their facilities, and they brought people to the table that were critical to this conversation. And so when you have a foundation that's willing to support, for me, for you, it just means so much. And so I hope everybody's willing to support on Monday, because we have to grow this Pride Fund. There's so much work that Wellness is trying to do. And I think that it's critical that as the fifth largest county, we have to get behind the queer community to make sure that we are providing the supportive services that are necessary.
Gosh. All right. Well, thank you both. I'm going to let Alex, if there are any other questions that came in, maybe she can just give us a thumbs up or put them in the chat. That would be helpful. If not, I will start the closeout of the conversation. But first, just wanted to thank Lydia, Stevie, and Nisi. My goodness, I'm humbled, impressed, and re-energized by your comments and thoughts. Humbled, I think, definitely as one of the founders. And, we knew it was the right thing to do, but I don't even know that I recognize the importance of the fund, at least, through your lens. So that's really helpful, and, actually brought tears to my eyes. So I'm going to just keep talking. So thank you. And it's also, I would say, to what Lydia, it's also have been our on-ramp to some ways of starting and digging deeper into our racial equity work too. So that connection has been incredible as well. So I wanted to thank you first. Want to thank our viewers as well. Thank you for showing up. And don't forget to check out our magazine, our Passion and Purpose magazine. Look for it on our website next week. It'll give you more, again, information about how the fund started with our personal stories as founders. It talks more in depth about some of the grant making that we have been able to make, more of the dollars and amounts and all of that, but talks about as well, the work and the training that Nisi and Stevie just talked about. So gives you a sense of that, and as well as Stevie's census work. We made the first grant that we made out of the Pride Fund was to support Wellness in their Get Out the Count efforts for the census, knowing that our LGBTQ plus population, they're vulnerable, maybe not trusting of a census, and so we needed a trusted partner to help us make sure that we were counted, right? So that's in the, again, a lot to share in there. And then finally, wanted to share our donors. So thanking all of our donors who have already given to the fund. But again, like I said, we can't stop here. We've reached our initial goal. So we're asking you to help us double that. I know I'm probably sounding like we're on NPR. I do not have like a gift tote or anything to give you or a bumper sticker, but we might. I'm thinking t-shirts. We're going to work on it. But all that to say is let's double the pride. And I mixed up. I'm a week ahead. So it is not next Monday. It is actually Monday, June 28th. It's the history of the Stonewall, right? So I mean, if you want to start giving as of next Monday, great, but we're going to be making the really big push and making it really a push on our social media. It's Monday, June 28th. So I did mix that date up a little bit. But again, help us double the pride. We reached 50,000, but we want to get to 100,000 so we can keep making grants to these amazing organizations who are having the tough conversations in the community to ensure that our youth and this population are receiving the services that they need. So with that, unless there are any other comments, we can sign off. And just thank you again, Nisi, Stevie, Lydia. Really appreciate it.